The cancer warning sign most doctors ignore. 3 months ago, Sarah lost 15 pounds without changing her diet or exercise routine. Her doctor congratulated her on the healthy weight loss. 2 weeks later, she was diagnosed with pancreatic cancer. Medical guidelines define unexplained weight loss as losing 5% or more of body weight within 6 to 12 months without trying, so Sarah's 15-pound loss should have triggered a deeper evaluation. The American Cancer Society notes that unexplained weight loss is often the first symptom in 30 to 50% of pancreatic, stomach, esophageal, and lung cancers. Yet most doctors and patients celebrate unexpected weight loss instead of investigating it. But why do medical professionals consistently miss these warning signs? 2. The hidden pattern doctors miss. The answer lies in how medical education and healthcare systems approach early cancer detection. In that brief window, they process symptoms, review medical histories, and make diagnostic decisions that can literally determine life or death outcomes. Major medical textbooks focus heavily on advanced cancer signs, dedicating entire chapters to obvious presentations, like severe abdominal pain for pancreatic cancer or persistent bloody cough for lung cancer. These clear symptoms represent patients who already have advanced disease. According to American Cancer Society guidelines, unexplained weight loss appears months earlier but is rarely taught as an early red flag in medical training. This educational gap creates a dangerous cognitive bias called anchoring bias. When patients present with subtle symptoms, doctors anchor their thinking to the most common, benign explanations. A patient complaining of persistent fatigue gets diagnosed with stress or depression. Someone reporting digestive discomfort receives a prescription for acid reflux medication. The physician's mind immediately jumps to statistically likely conditions rather than considering less common but potentially serious causes. The modern healthcare system amplifies this problem through structural constraints. Insurance companies reimburse doctors for volume, not thoroughness. Physicians must see 25 to 30 patients daily to maintain profitable practices. This time pressure forces doctors to make quick diagnostic decisions based on incomplete information. When faced with ambiguous symptoms, they choose the path of least resistance rather than pursuing comprehensive investigations that require multiple appointments and expensive testing. Patient expectations also contribute to diagnostic failures. Society has conditioned people to expect quick fixes and immediate explanations for their symptoms. Patients become frustrated when doctors suggest watchful waiting or gradual diagnostic processes. They want definitive answers during single appointments. This social pressure pushes physicians toward rapid diagnosis rather than careful observation of symptom patterns over time. Standard medical protocols also limit diagnostic flexibility. Healthcare systems implement guidelines designed to reduce unnecessary testing and control costs. These protocols specify which symptoms warrant immediate investigation and which can be managed conservatively. While these guidelines help manage healthcare resources, they sometimes prevent doctors from pursuing hunches that could lead to early cancer detection. The tragic irony is that one particular symptom exemplifies all these diagnostic failures perfectly. This symptom appears in medical literature as a red flag requiring immediate investigation. Every oncology textbook lists it as a primary warning sign for multiple cancer types. Yet both doctors and patients consistently ignore or celebrate its appearance. That symptom is unexplained weight loss. Despite clear medical guidelines identifying this as a potential cancer warning sign, most people and many physicians treat unexpected weight loss as a positive development rather than a cause for concern. Understanding what makes this symptom so significant requires examining the precise characteristics that separate normal weight changes from dangerous warning signals. 3. When your scale becomes a warning system. Your bathroom scale might be trying to save your life, but most people miss the message entirely. Medical literature defines unexplained weight loss as losing 5% or more of your body weight within 6 to 12 months without deliberate diet changes or increased exercise. For a 150-pound person, that means losing just 7.5 pounds should trigger immediate medical evaluation. Yet, when people step on their scale and see those lower numbers, their first reaction is usually celebration, not concern. Oncologists know that unexplained weight loss represents one of the most reliable early cancer indicators across multiple tumor types. The American Cancer Society specifically identifies this symptom as often the first noticeable sign of esophageal, pancreatic, stomach, and lung cancers. Cancer specialists understand that when patients report losing 10 or more pounds without trying, comprehensive diagnostic workups become medically necessary, not optional. The stark contrast between medical knowledge and real-world practice creates deadly delays in cancer detection. Patients who lose weight unexpectedly often receive congratulations from friends, family, and even healthcare providers. Primary care physicians frequently focus on celebrating the weight loss rather than investigating its cause. This disconnect becomes even more problematic when examining the specific threshold that medical research identifies as significant. Studies published in JAMA demonstrate that recent weight loss creates significantly increased risk for upper gastrointestinal tract, blood, colorectal, and lung cancers. The research shows clear statistical relationships between unexplained weight reduction and cancer diagnosis within the following months. Despite this documented medical evidence, standard medical protocols often treat unexplained weight loss as a positive health development rather than a diagnostic red flag. Cancer-related weight loss operates through completely different biological mechanisms than intentional weight reduction through diet and exercise. When people lose weight through caloric restriction or increased physical activity, they lose fat tissue while preserving muscle mass. The weight loss occurs gradually and responds to changes in eating patterns and activity levels. Patients maintain energy levels and feel physically stronger as they shed excess pounds. Pathological weight loss from cancer follows an entirely different pattern. Cancer cells create metabolic chaos within the body, demanding significantly more energy than healthy tissue requires. This increased energy demand continues regardless of food intake levels. Patients lose both fat and muscle tissue simultaneously, a process called cachexia that creates weakness and fatigue rather than improved fitness. Several subtle accompanying signs often appear alongside concerning weight loss, but receive little attention from patients or physicians. Persistent fatigue that doesn't improve with rest frequently accompanies unexplained weight reduction. Changes in taste perception make previously enjoyed foods seem bland or metallic. Vague digestive discomfort, including mild nausea or early satiety, often develops gradually. These companion symptoms seem minor individually, but create significant diagnostic clues when considered together with unexplained weight loss. The cancers most likely to announce themselves through unexplained weight loss share important characteristics that explain this connection. Pancreatic, lung, stomach, and esophageal cancers all interfere with normal digestive processes and create profound metabolic disruptions that begin months before obvious symptoms develop. Understanding exactly how these malignant cells commandeer your body's energy systems reveals why they create such dramatic changes so early in their development. Or, the metabolic hijack cancer creates. Cancer cells operate like energy vampires within your body, consuming resources at rates that would kill normal cells. While healthy cells use energy efficiently and respond to the body's regulatory signals, cancer cells ignore these controls entirely. They multiply rapidly and demand exponentially more glucose and nutrients than the tissues they replace. This creates an internal competition where malignant cells literally steal energy from vital organs and healthy tissue. Cancer cells consume more energy and release inflammatory signals that disrupt appetite and metabolism, leading to both fat and muscle loss in a process called cachexia. This metabolic shift creates cascading effects throughout the body's energy systems. Cancer cells consume glucose at rates 10 to 50 times higher than healthy tissue. They also demand increased amounts of amino acids, the building blocks of proteins that maintain muscle mass. As tumors grow, they establish their own blood supply networks to support these massive nutritional requirements. The body's energy reserves begin depleting even when patients maintain normal eating patterns. Tumors release cytokines and other inflammatory substances that disrupt normal appetite regulation and metabolic control. These chemical signals interfere with hormones like leptin and ghrelin that normally govern hunger and satiety. Patients lose their ability to recognize genuine nutritional needs. Food may taste different or become less appealing. The body's internal thermostat for energy balance becomes completely unreliable. The timing of these metabolic disruptions explains why unexplained weight loss appears so early in cancer development. Metabolic changes begin when tumors are still microscopic and undetectable through standard imaging. Months before patients develop obvious symptoms like pain or visible masses, their cellular energy systems are already under attack. The scale registers these internal battles long before patients feel sick. Many patients initially experience increased energy levels despite losing weight, creating a dangerous false sense of wellness. The body responds to metabolic stress by releasing stress hormones like cortisol and adrenaline. These hormones can create temporary feelings of alertness and vigor that mask the underlying disease process. Patients often report feeling more energetic than usual during the early stages of cancer-related weight loss. Different cancer types create distinct metabolic fingerprints that manifest as specific weight loss patterns. Pancreatic cancers disrupt insulin production and glucose regulation, causing rapid muscle wasting alongside fat loss. Lung cancers increase the body's oxygen demands while simultaneously reducing lung capacity, creating metabolic stress that burns through energy reserves. Stomach and esophageal cancers directly interfere with nutrient absorption, starving the body even when patients continue eating normally. Research published in JAMA demonstrates that these inflammatory cytokines and metabolic changes make weight loss a persistent symptom that remains unresponsive to rest or dietary modifications. The weight loss precedes diagnosis in multiple cancer types by several months, creating a critical window for early detection. However, unexplained weight loss rarely appears as an isolated warning sign. 5. The companion symptoms that seal the diagnosis. Medical research consistently shows that patients later diagnosed with cancer typically experienced multiple subtle warning signs for months before receiving their diagnosis. These symptoms often seem completely unrelated to each other, which explains why both patients and physicians miss their collective significance. A person losing weight unexpectedly might also develop persistent fatigue, mild digestive changes, and intermittent cough, but they treat each symptom as a separate minor issue rather than recognizing the dangerous pattern. The fatigue that accompanies cancer-related weight loss differs fundamentally from normal tiredness that improves with adequate sleep or rest. Cancer-related fatigue feels overwhelming and persistent, continuing despite 8 hours of sleep or weekend relaxation. Patients describe feeling exhausted after minimal physical activity, like climbing a single flight of stairs or walking to the mailbox. This exhaustion often worsens throughout the day and does not respond to caffeine or other stimulants that normally provide energy boosts. Digestive changes frequently accompany unexplained weight loss in pancreatic and stomach cancers. Patients develop subtle nausea that comes and goes without obvious triggers. Food tastes different, often metallic or bland, making previously enjoyed meals unappetizing. Vague abdominal discomfort appears intermittently, described as fullness or pressure rather than sharp pain. These digestive symptoms seem minor individually, but they represent early signs of cancer affecting the digestive system. Chronic cough patterns signal potential lung cancer, especially when accompanied by weight loss. The persistent cough differs from typical cold or allergy coughs because it continues for weeks without improvement. The cough may produce small amounts of blood-tinged sputum, which patients often dismiss as irritation from coughing itself. Breathing changes become apparent during routine activities, with patients noticing slight shortness of breath when climbing stairs or carrying groceries. Studies, including data from the Nurses' Health Studies, demonstrate that tracking multiple subtle symptoms together significantly improves early cancer detection compared to monitoring individual symptoms in isolation. When physicians evaluate patients presenting with unexplained weight loss, plus persistent fatigue, digestive changes, and chronic cough, comprehensive cancer screening becomes medically appropriate and necessary. The timing of these symptom clusters provides crucial diagnostic information. Symptoms that develop simultaneously over several months suggest systemic disease processes rather than coincidental minor health issues. Patients who document when each symptom began and how they progress over time provide physicians with essential information for proper evaluation. Understanding these symptom patterns transforms patients from passive recipients of medical care into informed advocates for their own health. However, recognizing concerning symptoms represents only the first step in the early detection process. The critical challenge becomes communicating these concerns effectively to healthcare providers who face time constraints and competing diagnostic possibilities. 6. How to make your doctor listen. Success depends on preparation and strategic communication during medical appointments. Even patients who recognize dangerous symptom patterns often struggle to convey their concerns effectively during medical appointments. The average physician appointment lasts 13 minutes, creating intense pressure to communicate complex health information quickly and persuasively. Patients who fail to present their symptoms clearly often leave appointments without appropriate testing or referrals, potentially missing crucial opportunities for early cancer detection. Communication barriers within medical settings create systematic obstacles that prevent even informed patients from receiving proper attention. Physicians operate under significant time constraints and cognitive biases that favor common diagnoses over serious but less frequent conditions. When patients present symptoms vaguely or emotionally, doctors often dismiss legitimate concerns as anxiety or health-related worry. The medical establishment rewards efficiency over thoroughness, creating environments where subtle cancer symptoms get overlooked or minimized during routine visits. Medical professionals respond more seriously to patients who frame their concerns using precise medical terminology and specific quantitative data. Instead of saying "I've lost some weight recently," effective patients state "I have lost 12 pounds over the past 4 months without changing my diet or exercise routine." This specific language immediately signals medical significance because it meets the clinical definition of unexplained weight loss that triggers cancer screening protocols. Doctors recognize precise numerical data as medically relevant information rather than subjective patient complaints. Documentation transforms vague symptom reports into compelling medical evidence that physicians cannot easily dismiss. Patients should maintain detailed symptom logs that include exact dates, specific measurements, and accompanying circumstances. Recording daily weight measurements, fatigue levels, digestive changes, and respiratory symptoms creates objective data that supports requests for comprehensive testing. Written documentation demonstrates patient reliability and provides physicians with concrete information necessary for proper evaluation. When losing more than 5% of body weight without trying, patients should ask explicitly for testing, citing American Cancer Society and National Comprehensive Cancer Network guidelines that identify this threshold as medically significant. Requesting specific medical interventions requires strategic communication that avoids confrontational language while maintaining firm advocacy positions. Phrases like, "I'm concerned about the possibility of cancer given my unexplained weight loss," directly address serious diagnostic considerations without seeming demanding or difficult. Asking, "What tests would you recommend to rule out serious causes of unexplained weight loss?" frames requests as collaborative medical decision-making rather than patient demands. Research consistently demonstrates that informed, persistent patients achieve significantly better health outcomes through early disease detection and appropriate medical intervention. Patients who effectively communicate their concerns and advocate for comprehensive testing receive diagnoses months earlier than those who accept superficial medical evaluations. This earlier detection often means the difference between successful treatment and advanced disease progression. However, effective communication represents only one component of successful early cancer detection. 7. Conclusion. Taking action based on this knowledge becomes your most powerful tool for early detection. Start monitoring your weight patterns immediately, documenting any unexplained changes with specific dates and measurements. Track accompanying symptoms like persistent fatigue, digestive changes, or respiratory issues that could signal serious disease processes. When you lose 5% of your body weight within 6 months without trying, present this documentation to your healthcare provider using precise medical terminology that requests appropriate diagnostic testing based on established guidelines. Unexplained weight loss is a proven early warning sign backed by decades of medical research. The difference between early and late-stage cancer detection can mean the difference between a 56% 5-year survival rate and 19%. Don't celebrate unexplained weight loss. Get it evaluated. If you found this video helpful, please like, subscribe, and share to someone you love. Thank you very much for watching.